For those of you who just came in, I'm Shireen Yates, founder of 6Sensorlabs. Our first product is NEMA. It's a portable sensor to help people test their food for proteins and allergens. And we're starting with gluten, and we're launching into peanut and dairy in 2017. And I started this concept, I started thinking about it about 10 years ago when I suddenly out of nowhere started to get really, really sick, really bad intestinal pain. No one knew what was happening. And the last thing on my mind was that it was actually food that was causing me to feel this way. And I finally got diagnosed by a doctor that did a lot of screens and said, actually, sure enough, Shireen, you are intolerant and allergic to gluten, dairy, egg, and soy. Never had issues with food before. So I was like, mealtime for me was really like the best time of day. Food, I was raised in a family where food is religion. Everything revolves around dinner time, lunchtime, breakfast time. We're thinking about the next meal as we're eating the current meal. So food is important to me. And suddenly 90% of what I was putting in my body was suddenly poison, and I couldn't eat it. And I really had to shift my lifestyle and change the way that I went around just eating and viewing food. And food became medicine to me. And it was still a time of enjoyment, but incredibly stressful. And before I started working on this, had a sales and marketing role. I was at Google and then at Facebook, and I was constantly traveling, and I was constantly getting exposed to foods that I was actively trying to avoid. And I noticed even in my own group, in my own setting of friends and family, people were becoming much more aware of how food was affecting them. So I'll just pause here to say, do any of you have food intolerances and food allergies?
I'm just discovering, like you, I'm almost going to burst out into tears because my daughter and I just, within the week,
For gluten?
gotten all of gluten intolerant, gluten sensitivity, allergic, not to soy, but won't eat it anyway because of the estrogen, and trending toward celiac disease. I had no clue except that I've gone to doctors throughout the years who never thought to test me for this until now.
Right.
And so your whole food as medicine, it
resonates.
Huge.
Well, I'm so glad that you guys are.
Myself all these years.
And poison's the word that we hear so much from our consumers. Thanks for sharing. Anyone else? Pardon me?
How do you get tested?
Asked to be tested? Yeah, you can share your experience.
I've gone to an integrative doctor who's also an MD, who is a thinker outside the box. That's what it's taken.
There's blood tests. They can do biopsies, stool tests. They usually do it. For celiac disease specifically, they have to do a endoscopy and figure out, if your intestine is reacting to gluten. You have to be eating gluten to see. So it's hard. It's hard because you just sort of, I think from the medical perspective, you just want to jump to, here's the pill you need to take. Here's the solution to the problem. And
I rejected just last week with my traditional doctor for my yearly checkup. Again, as always, complaining about my gut. And he said, well, I have the same thing. You can take a pill when you're missing the point.
Yeah.
I don't want to mask what's really going on.
Right.
So because it's so widespread, why isn't gluten just a natural test of your medical record?
Well, it's not necessarily, so from a mass market perspective, 1% of the population suffers from celiac disease, and then an estimated 6 to 7% has non-celiac gluten sensitivity. And so it's, when you think about widespread, is that widespread from the medical perspective? No, not really. Italy actually has a national screen because their diet is so gluten heavy. They have a national mandatory screen before you're 5 for celiac or celiac disease.
The reason I say that is consumer-wise, you look at across the board, you go to the market, gluten-free, gluten-free, gluten-free. There's so much product on the market that's gluten-free.
Yes, yeah.
So it seems like it would be a lot.
It's marketing, and 90 million Americans are actively avoiding gluten because they feel better. And I mean, my theory there is we don't want to prevent those folks from buying our product. I'll do it, But I think that people are cutting out processed foods and feeling better, and just bucketing gluten as the sole cause of that. Whether or not that's right.
I went to my doctor because I knew I had some kind of allergies.
Yeah.
And they tested for allergies, but they weren't severe enough to cause anaphylactic shock and death. So they had nothing to offer me, and I found a lab on the East Coast that did tests, and I knew I was gluten intolerant.
You found out.
Yeah.
And have you has that changed the way you eat?
Yeah. I mean, 10 years ago when I found out that it was gluten,
Yeah.
I was fasting. I fast every year or so. And the doctor was ready to give me medication for arthritis because my joints hurt, and when I got up in the morning, my knees hurt.
Yeah.
I went off of wheat, and all those arthritis symptoms disappeared.
Wow. That's so, it's so great to hear.
They don't have the test.
For non-celiac gluten sensitive, if you don't have like the marker for celiac disease, there's really no medical way to tell unless you just come to the doctors and say, I think I'm reacting to this protein. There's no screen, there's no marker, there's no IgE response.
So I had to have the test done elsewhere and then went back to my doctor.
Yeah.
But all of those symptoms disappeared, and they were going to give me pills.
Yeah. Right. Well, I'm so glad to hear that you're more aware and taking control of your diet. But I ask you, both of you, I think, especially when you're eating out, I mean, do you find it challenging to navigate the diet?
Yes, and there are times when I have reactions afterwards where I didn't realize I
Right,
would.
right.
And sometimes I'll go out and just know that for a few days I won't be feeling well.
Right. Yeah, and we'll get into that. Did you have a comment?
Well, I do.
Yes.
I have had sugar sensitivities, wheat sensitivities, cow dairy, and so have been tested, and there are such tests, and I will speak to you as the authority. I go and I have what's called muscle testing.
Mm-hmm. I've heard of it.
They use a sensor in your hand, and the machine is built by NASA, and it has in the database all the different foods and sees how you react from this sensor on your hand, and they tell you exactly what you need to not eat or be cleared for. And some things can be cleared and some things can't be cleared. And this particular healthcare practitioner gives me certain things to help me. They've helped me enormously.
That's so great.
Enormously. Yes, that's exactly right. Well, I go to a woman, Vivian Kushner. She's in Mill Valley, and Vivian is excellent. And I have to just say that a couple weeks ago I was having terrible allergies.
Seasonal allergies. That's why I'm sniffling. By the way, allergy is not a cold. Just I don't want to.
I went
Scare him with the contagious.
because
Yeah.
this all of a sudden happened.
Yeah.
She said, "Let me test what you're taking," because I took another version of Zyrtec that my husband had bought.
Yes.
She said, "This isn't helping you. Go back to the Zyrtec, you'll be fine."
Yep.
And she cleared the molds and the pollens that I have problems with.
Yeah.
I'm fine.
Amazing.
So, I mean, I have used myself as the model.
Right.
And I'm telling you, there is hope. It's really non-traditional kinds of medicine that has these kinds of modalities.
And you're seeing the results.
Tremendous. Now, I can't drink. I can't eat wheat. I mean, on occasion I don't have sex. That's all I can do.
Otherwise, you go to a monster.
No sugar. Let's start with the sugar. No sugar.
Yeah.
Okay, so when the French bread comes, I can smell it across the room, but
And-
I don't eat it.
Good for you.
So there is help for people, and unfortunately, traditional medicine
Yeah.
does not really help.
Right. And 10 years ago, I went to a non-traditional doctor, nutritionist who found out about all these issues.
That's how I found out.
Yeah. Yeah. So hopefully, I think. Right. Yeah. It doesn't. So I think yes.
Is it more prevalent, or is it just people are more aware, or people are eating more wheat?
It's an excellent question,
You
and
didn't hear about it 12 years.
it's a combination. In terms, it is more prevalent. Not only for celiac disease, they actually did this blood study where they studied blood types for the celiac marker about 50 years ago, and current did this side-by-side sample, and they found that it's 4 times more prevalent today than it was 50 years ago, celiac disease. And for food allergies, we've seen a 50% increase in food allergies among children over the last 15 years in the United States. Now, the reason as to why, that's a whole other talk. That's a whole other talk. I mean, there's a lot of, there's a lot of hypotheses. Maybe the hygiene hypothesis, we're not exposed early on enough to build up our immune system. The food processing is different. The protein of wheat, the structure of wheat, the agricultural practices are different. The way we store wheat over time builds molds. That's also different. So there's a lot of, it's hard to isolate. Yes?
Well, if you're developing some sensors, it just drives me crazy because all the schools in San Francisco, private schools, are nut-free.
Peanut-free zones,
No,
nut-free?
nut-free.
Okay, just nut-free.
In California, we grow almonds, you know, I mean, all of that, so there's this fine line
Totally.
about banning a really wonderful, healthy food.
Yeah,
With the whole, I mean, my daughter went to Hamlin, no nuts.
right,
No nuts.
right.
And so I don't know with the sensors, I mean, we kind of have gone to the extreme.
Yeah.
Of,
So this is a great point for a transition into what we're doing, and you got into why we're doing it. And where we step in as a company is when you have all gone to those amazing doctors and nutritionists and know what your triggers are. So once you know what your triggers are in terms of food and how food affects you, we want to build solutions to help you navigate specifically eating socially, eating out. So with that, this is a little bit about the market in terms of how eating is a gamble. I think we all get this. The other part of this is that food isn't that transparent. There's complex supply chains, complex ingredients, reading ingredient lists. You don't really know what it's saying. I think there's like 500 ways to say sugar these days in an ingredient list. And also this matters for not only consumers in terms of how much they're spending on food allergies alone or food sensitivities, but also food manufacturers. That you look at and food retailers. You look at the Chipotle outbreaks. I mean, something like that can absolutely destroy your brand. So it matters to the bottom line. It matters to the heart. It's important. And when we look at just the market overall, when we look at the U.S., 1 out of 3 people every year are getting sick from their food. And that includes people who have food sensitivities and allergies. It includes foodborne illnesses. Also people who have autoimmune diseases. If you know folks with Crohn's that are really actively trying to manage their diet, again, is food as medicine. And I talked about the increase a little bit in terms of what we've seen for food allergies, the prevalence of it, but also in terms of food recalls. If you look at over 50% of all the food recalls in the U.S. are due to undeclared food allergies. And this results in deaths, hospital visits that can totally be prevented if we had the right data. This is a breakdown for gluten, who you guys had a little discussion about people who have celiac disease, non-celiac gluten sensitivity. The reason why you walk into Whole Foods and you see 1/8 of the store dedicated to gluten-free is because 90 million people in the United States are actively avoiding gluten. And that breaks down with, in terms of the people who have a physical reaction to the protein, that's about 20 million. And that includes the non-celiac gluten sensitive, the folks that don't have the marker but are reacting, and that includes the celiac disease population as well. So when we think about our target market for NEMA, our target is that these people that are having a physical reaction to the protein, that are willing to pay to test their food and wait for that result. So that's really the backdrop for NEMA. I started the company at MIT. It was actually between my first and second year. I went to MIT to get my MBA on the platform of helping people with food intolerances. The idea just didn't really crystallize until I went to this wedding over the summer between my first and second year. I actually usually bring my own snack packs to weddings. It's very unsexy, but I have my own food. And at this particular wedding, I forgot my snack pack, and I was famished. The hangriness was coming on, and I didn't want to scare anyone away, so I asked the waitress, are these appetizers gluten-free, these delicious-looking risotto balls? And she said, how allergic are you? And it was at that moment that I think my hanger really kicked in, and I was like, I am so tired of that question. It doesn't matter what my motivation is if I'm allergic. If I don't want to eat gluten, I don't want to eat gluten, and I should have the power to know whether or not that sample has gluten in it. And so my friend John was standing next to me, who happened to be a PhD in chemical engineering, and I said, John, we have put someone on the moon. We have put someone on the moon. How hard is it to take a sample of this food and know if there's a protein in it? I just want to take a sample to know if gluten is in it. I know it's not going to guarantee the whole plate is. I just want that data point. And he's like, it shouldn't be that hard, actually. Well, it turns out it's really challenging, but it is doable. And that was really the backdrop of 6Sensorlabs. And when we started thinking about this ecosystem of, okay, You empower people to test their food. What does that look like? What technology? But the piece that was also really important was, how do we take that single data point, that test point, and scale it so that we can aggregate all these tests that people are doing every day and create this whole map of food testing that goes beyond the nutrition label, goes beyond the menu item, and you can actually see, like, all right, when I go to San Francisco, I can actually see what's being tested for gluten, and I can trust the data rather than, you know, the waiter or the, you know, the things that you can't necessarily trust. Technology-wise, there's really 3 components. Rapid sample preparation. You take a complex matrix of food, you put it in a little platform, a little disposable capsule, and then antibody, it's basically a chemistry sensor. Crudely put, it's a pregnancy test for food. That's what we developed. And then the sensor itself, we've developed this unique algorithm. So we have a lot of IP around all those 3 facets of the company. And this is a little bit about the platform. I'm going to just show you guys the NEMA here, and I'll let you pass it around. But this is the device, and then this is the disposable capsule, which has the pregnancy test for food in it that you can kind of see if you want to pass that around.
Is it on the market?
It's not on the market yet. You can pre-purchase it at a discount at nemasensor.com today, but we're shipping it this year. So we're going to be shipping it. So we launched a sort of Kickstarter-like campaign on our own website. And so you can see we're starting with allergens, we're moving to pathogens. Food safety is a really interesting market for us, especially as we think globally. And then we're targeting consumers first. That's where we identified a real need. But as we've been getting some press, we're seeing that there's a real interest at the food manufacturer level as well and food retail level, and there's an opportunity there. When we think about the data, we hear a lot about health data. We're going to get all this data, but what are we going to do with it? Specifically for us, there's opportunities for creating a better community of people who have similar dietary profiles to see what each other are testing. There's an opportunity for restaurants and food services, and then an opportunity for packaged foods. And specifically for community, so Pika Pika is a restaurant in San Francisco. It's certified gluten-free, and it's delicious. And imagine if you can go in and see how many tests that have been done for the specific dish and what might appeal to you based on your, not only your dietary profile, but your food preferences. So you can walk in and say, I love fish, I'm a pescatarian, I'm gluten-free, boom, this is fish tacos you should order here. And by the way, it's been tested 10 times over the last week, so you're good to go in terms of gluten-free. That's our vision for the consumer app. This is in terms of building a layer of recommendations based on the food testing. So if people at a particular restaurant test a sample of food continuously for gluten, and it's actually, gluten-free dish is actually gluten-free, we can build this whole recommendation layer of saying NEMA recommended restaurants based on food testing data. And then finally, an enterprise dashboard. General Mills had a recall of gluten-free Cheerios that the market had been clamoring for. We want gluten-free Cheerios. We have such great childhood memories. My daughter can't enjoy them. So they put it out of the market, and people started to react to the Cheerios. People with celiac disease, people with gluten intolerance. They were saying, I'm getting sick from these. I don't think they're gluten-free. And it took them about 8 months to finally initiate the first recall. And they recalled a lot, and there was cross-contamination. And they tested it, and sure enough, it wasn't 100% gluten-free. So imagine if they had actually test data available to them early on, they could have responded a lot faster and had that data available to them. So we think there's an opportunity for an enterprise dashboard as well. And when you think about the supply chain too, we talked about the lack of food transparency, a lot of confusion in the supply chain. We think we can bring more visibility and transparency to food supply chains. And I'm not talking about replacing what companies are doing today, because they're investing millions of dollars in PCR machines, in-house technology. What we're talking about with NEMA as it relates to the commercial market is supplementing what they have. And so when you look at the market, when you look at consumers and commercial, we see a real opportunity with consumers, but also a healthy market for commercial, $15 billion a year in terms of the addressable market. And then just as a little bit of progress from the start, we started in 2013. We developed our own antibody for gluten, and built a team at MIT, chemical engineer and a mechanical engineer. And then we developed our test strips. Then we developed the hardware, and we kept working on making it faster and faster. And to provide a little more context here, when you think about options you have today as a consumer to go out and eat and test your food, well, there are some kits actually you can use to test your food, even for gluten, but they're chemistry sets. They ask you to take a mortar and pestle and grind the food. They ask you to take 2 solutions and process it. Then they ask you to spend $20 per test and then wait 15 to 20 minutes until you get the result. So how many consumers are using this? No one's using this. So what we wanted to do is take that process and put it in a really attractive consumer device that speeds that process up. And today, our processing takes about 2 minutes. So we took that 20 minutes down to 2 minutes and put it in this portable device. Our team is actually 17. We just hired one. We're based full-time in San Francisco, and it's been quite a journey since we started about 3 years ago. And then we are VC backed, and we raised our seed round in 2014, and then just closed another round, and that should support us through the commercialization through NEMA gluten, which is set to launch this year. A little bit about our testing. It's a text-heavy slide, so don't look at it, just listen to me. But essentially what we wanted to do is get this in the hands of people as quickly as possible, and we have about 40 beta units out. People are testing them, they're sharing their results. A few big surprises. So in the Bay Area, we tested hundreds of gluten-free labeled menu items in the Bay Area, which I would argue is one of the food capitals of the US, a lot of health-conscious folks. And we found that now 25% of the labeled gluten-free menu items with our latest data is actually not so gluten-free. 25% of those dishes. And that actually lined up really perfectly aligned with the consumer feedback we were getting. Is I'm getting sick 1 out of 3, 1 out of 4 times that I'm eating outside of the home, trying to actively avoid gluten. And we hear that for other allergens as well. So it's a big issue. The next big thing up for us, I think you all have heard, I don't know if you know of Theranos, but have heard the hype in the press. I think it just highlights the importance of third-party validation and really backing your data with a lab. And that's the next stage we're in. We have about 1,000 units coming off the manufacturing line, and we're doing a ton of testing and third-party validation, compare our standards to a lab, and then publish those results. So that's next for 6Sensorlabs. By the way, I invite you all to ask questions along the way and interrupt me if anything comes to mind. Lab-wise, it's out of Nebraska, so Dr. Stephen Taylor does a lot of food testing with the gold standard, and so that's who we're likely going to be going through. Yeah.
What's the price point, or how do you monetize it?
Yeah, great question. So the price point is, I'm going to just jump to that real quick. So we're retailing the sensor at $249. Right now on pre-sale it's $199. We offer it at a discount because we're not telling you exactly when you're going to get it. But $249 is the retail price point. Now the per pod, that's a per-use disposable capsule, okay, one-time use, and that's because of cross-contamination. You can't clean it the way the chemistries run. And so that little plastic tube that goes in there, that pregnancy test for food, is indeed like a pregnancy test, one-time use, and that's retailing at $399. And what's the comparable to that for consumers is the $20 price point that the kits are allowed today. And those are our starting price points. The vision, let's get down to $50 for the sensor, or even give it out for free and get each test down to $1. That's where we need to go.
So $3.99 meaning
$3.99. $249 for the sensor, $3.99.
So how pregnancy test just means that it's positive or negative?
Exactly, positive or negative.
No percentage is positive.
Positive or negative.
Change it doesn't.
Right. But we are actually collecting this data on the sensor side to see sort of the intensity of the level of gluten in the sample. And I think for a lot of people, they're like, I have no idea what level of gluten I react to. And where we've set our threshold is what is defined as gluten-free by the FDA, which is 20 parts per million. Do you know how small that is? 20 parts per million could trigger a reaction for someone. But everyone goes off of that. But a lot of people don't know. Maybe it's 100, maybe it's 200. And I think we have a huge opportunity to give that data and have people see how do I feel? What is my threshold? So to start, it's a binary yes or no. And once that finishes, we'll just run a test. And you can see how it processes. And then
You collect that through a sensor, and so you know what the data is without the people having to send it to you?
Yes. exactly.
And think about what that does for, you know, all the doctors that like to go through and you know, test for celiac. I mean, all these other diseases that you have to actually have surgery for to find out if you really have it, or you have to do very expensive blood tests, $1,000.
You do.
And it just breaks it down so that you can find out what they're allergic to. This is sort of the first stage.
Exactly. Exactly. Yeah. And on average, it takes someone 14 years to get properly diagnosed with celiac disease. 14 years in the U.S. And surgery.
Take a sample from your actual gut, they will not verify it.
While you're still eating gluten is the key. So if you think you have celiac disease and you're still eating gluten, go get a biopsy is the takeaway for all of you.
So in order to use this,
Yeah.
say you have 3 meals a
Multiple
day.
things, yeah.
I mean, you're using it multiple times during the day.
Yeah.
And it seems that it's pretty hard. I mean.
Cumbersome.
Yeah.
Yeah.
And how accurate if maybe over 4 days you use it 6 times, no problems, and then that 7th time you don't test it and you have a reaction.
So I'll tell you what our hypothesis was going into this, based on a lot of the market research, and then what some of the early users have told us and with their behavior of how they're using it. Hypothesis was people would use this 2 to 3 times a week. In those high-risk situations where they're eating out, in those uncontrolled eating environments, it's not at home, and they need that extra data point, like that risotto ball at the wedding, or that sauce or salad dressing, that you just want that extra data point. If you have a plate of a hamburger and you ordered it gluten-free, and it comes with gluten-free fries or a salad with dressing, you could take multiple things and put it in one capsule to get a sample. But what we found is from the user standpoint, users are typically very definitive about what they want to test on their plate. So in that example with the hamburger, I would say of our beta users, about 80% of them would test a bun, just to make sure that no one screwed up in the kitchen. Like that bun is actually gluten-free. And then we found too that people are, the biggest surprise from the beta testing is that people are using it at home much more than I anticipated. And I think of it as more like pantry validation. So I think initially there'll be this like uptick in usage when they order the device. They'll probably be sort of validating, all right, this has naturally gluten-free ingredients on this package, but it's not labeled gluten-free. I just want to test. So I think there'll be, maybe more usage than we anticipated at first, but then it'll likely drop off.
Is this used as a tool, as a challenge to something that says it's gluten-free, and you don't believe it, and you challenge that?
I think some people might use it that way, and we hope to not sort of create this tension point in the ecosystem. We hope it just to be a supplement, is what we're hoping for. Yes.
I had a question similar to yours about whether there was a gradation of how much is in, and also as your research and your work progresses, and you get into other possible allergens, and you may be able to gradiate, would that little machine be able to take and utilize the new research, or do you have to scrap it and buy a new machine?
Yeah. We have designed it so that you just have to basically swap out the disposable capsule. The base unit, the triangle, can remain the same. Now, if we come up with a design that'll bring down the price point significantly with a big redesign, then it would be obsolete, and there would be a planned obsolescence.
If you were going to do dairy.
All you would have to do is swap out the disposable capsule. Yeah, so basically the chemistry, everything else in the sensor would remain the same, because all the sensor is doing is seeing, did the reaction happen? And the reaction's the same, but the reagents in those change depending on what we're looking for.
Even if you develop a gradation like with gluten.
Exactly.
There's a little bit, or there's a lot.
Yep, it's all done through the firmware, all done through the algorithm of the sensor. Yeah, so it can be a sort of over-the-air update. Yeah.
What are the symptoms of celiac disease? I have no idea.
Because there's over 300 associated with celiac disease, and that's why it's so hard to diagnose.
Curly hair?
It's a gut. I have a friend that lost almost all her hair in high school. They thought she was on chemo treatments, and as a result of the hair loss, and she had celiac disease. I have a friend who breaks out in skin just rashes everywhere, and it kicks in 2 weeks after an exposure to the protein. It is a beast of a diagnosis because of all the varied responses people have. And usually the last thing on people's minds. We have talked to so many people that thought they had cancer, And it happened to, the diagnosis is fairly simple, avoid gluten, but in practice, it's very challenging to absolutely stay clean and keep a clean gut. And they've done studies where they track people who've been newly diagnosed with celiac disease and track the villi in your, the villi atrophy, which is the nutrient absorbing structure in your intestine. They kind of look like this. And when you have, they should be like healthy and long, and when you have celiac disease and you've been eating gluten, they're like this, and you're not absorbing other nutrients. And so they've tracked people and they say, all right, your celiac disease diagnosed, come back every year, and we're going to sort of measure your villi, however you want to pronounce it. And they found that 60% of diagnosed celiac disease still have a lot of damage, even when they're actively avoiding gluten. And I think it goes back to that 20 parts per million could trigger a reaction. Like that is 1/200th of a teaspoon. And it's just super hard to avoid. Super hard. So what we want to do is just provide an extra data point, a screen, to help you just improve the chances of staying healthy and being social.
What's your degree of sensitivity?
Mine?
No.
Oh.
No, do a test.
So because it's a consumer device and because we're not measuring the specific amount of food that goes into the system, we have to drive our chemistry to be very sensitive. Meaning at 20 parts per million, we can be very accurate, but that means that we might pick up less than 20 ppm. We might pick up 5 ppm. So it's very, very sensitive. And in that sense, we might be giving a false result. We're going to skew false result to false positive to false negative. Yeah, because the false negative would be very damaging, not only to your gut, but to the brand.
And there's no regulatory.
It's not a medical device because we're not saying, hey, if you have celiac disease, this is going to really mitigate your symptoms and you're going to use this to stay healthy, even though that all might be true. Our product positioning is, this is a food sensor. We're giving you this specific data. Use it as you want to. And that's a clear delineation. Yeah. A little bit about the roadmap. So we talked about what we want to do. On the top is consumer, the bottom is food retailer. On the consumer side, we want to get into peanut and dairy next in 2017. And again, that's just swapping out the disposable. Now, eventually, we'd love to get to a point where we could have 100 products on our list, and we could actually multiplex them, which means you could have a capsule that's custom to you. I could say gluten, soy, that's what you care about. Boom, here's your custom capsule. And that's years out, but that's where we want to go, all within this whole customized health regime element. Proving market demand. So we've sold 1,600 sensors. 20,000 disposable units, and this is basically just a tail end of Q4 2015 to now. So those are in our pre-order campaign, and we're set to start shipping this year. So it's going to be a massive year, busy year.
What about medical insurance covering this sort of stuff?
We had a few people who pre-ordered who were able to use their flexible spend accounts to cover it. So we've seen that. We haven't had a proactive outreach, just more because we're a really small team, but it is a huge opportunity. And the thing that I think about too is just access. Like, how do we get this? The price point is prohibitive for some, and how do we get access to this product? And insurance coverage is absolutely a way to go there. But we have seen FSA cover it. Yeah.
Are you trying to raise funds?
I'm always raising funds. Is the answer to that. So yes, and I have my card after too. I'm happy to give out. Just in terms of recognition, so this is some of the highlights of the press that we've received over the last year. It's really a testament to the team. I said there's 17, most of them are in the engineering side. Wall Street Journal did a great piece on just food safety, food transparency. This is a new product category, and we're not responsible for creating it. We're definitely responsible for contributing it, but if you look at other innovations that are coming out, the good news is you're going to have a device in your hand very soon to help you better navigate what you're eating. And there's a few other companies that are working in this space. So it's a really exciting time. Time magazine named us as one of the top 25 inventions of 2015. We had a celiac disease reporter who has celiac disease in the Huffington Post use the product, who just called it game-changing in the way that she approached her life. And then finally, TechCrunch has a hardware battlefield competition quarterly, and we were at the Consumer Electronics Show on stage. 600 companies applied, and we took home gold, which was really exciting. Thank you. We had amazing judges on the panel. They swap out, like, we had the CEO of Fitbit, which just IPO'd this year. We had the CEO of General Motors, the CEO of Intel, and to me, it was just not all of these folks have food allergies, but they get it. You know, most people know someone who has it. So it was very rewarding. Our go-to-market strategy, direct to consumer to start, nemasensor.com is our website, as I mentioned. And then scaling through retails as we have a more robust product portfolio with some of the other products we were talking about offering peanut and dairy. Question?
So are you hoping to sell this online as well as certain retail establishments?
Yes, yeah. And we're starting online. And just to promote our website, it's nemasensor.com. And then as soon as we have a more robust product portfolio, as we have peanuts and dairy and more retail space to take up as a brand, then we're planning to go retail. And when we ask our consumers, where do you expect to find this? Yes, Walgreens. What else? What else do you think comes up? CVS.
Walmart.
Target is another one.
Where the pregnancy tests are.
Walmart, where the pregnancy tests are.
The diabetes things.
Diabetes, yes. Product.
But like a Safeway or wherever you go.
So Whole Foods has come up as well. Yeah, it touches a lot. It touches the food side, the health side, the medical side. So I think there's a lot of opportunity, and a lot of it is how do we want to be positioned as a brand, and we really want to step away from that medical device feeling, and rather as this is, as when you walk out the door and you think cell phone, keys, wallet, Nema, like that's where we want to go. It's so integrated in your life.
Especially when you get the milk to go to Starbucks, because people have time when they're waiting.
Totally, yeah. And touching a little bit on also distributing through medical professionals. We have a partnership with MGH and Columbia right now. They have celiac disease centers, and the physicians there are really interested in distributing Nema as an intervention for folks that are newly diagnosed and measuring that quality life before and after they have Nema. So that's also in the pipeline once we get the product out there. And then a little bit on the commercial side, I was just in New York last week visiting the Amex corporate headquarters, and they have a cafeteria, and they cater not only to about 5 minutes. Okay, they cater not only to the folks in their building, but also anyone. It's a public cafeteria. They serve 5,000 lunches a day, which is insane. But they're really interested. The food service company that works with them is interested in figuring out how do we use Nema not only back of house, but also front of house. So we have, because they can't say gluten-free, but what they can say is made with naturally gluten-free ingredients. And so we did a test of where we think the hot spots might be in the cafeteria. And I'm gonna have you guys guess what came up with gluten. So we tested potato chips that are fried in a fryer, that they clean out the oil every day and they fry the potato chips first, trying to minimize cross-contamination. Test 1. Test 2, rice. Just rice. Test 3, a Udi's gluten-free branded bread, which we can all assume is gluten-free because they are probably have 90% market share, prepared on a cutting board that they share and the same knives that they share. So we tested all those 3. So what do you think came up positive for gluten? So who thinks bread? Oh, you guys are too smart. That was so much hype. There was so much buildup, and you just cut through it. Yeah, the bread. That's right. And they were shocked, though. Like, it was really illuminating. So some revenue projections. We'll skip through that. And then our team, like I said, our 17, we have designers on the medical device side. We have designers and engineers on the consumer electronics side, and both of those really serve as the backdrop. We talked about some of our enterprise opportunities. We talked about our medical advisory board. But that's basically it. So we really feel like we're transforming the way that you eat. We're transforming mealtime, and we want to ultimately equip you with better data to stay happy, to stay social, and stay healthy.